when the DRE 5-year programme was launched. And so the government gave 20 million year on year, which is 100 million, not peanuts, in order to address the deliver race equality, so address race inequality, and respond to the recommendations in the David Bennett Inquiry report. Looks like we're finally getting somewhere. Looks like Dr. Joanna Bennett's campaigning, long and hard, is going to lead to a change. So what's happening to David Olawale, Orville Blackwood, David Bennett is not going to happen again. Next slide, please. One of the things the government committed to do through this 5-year programme that's come to high personal price from our community, because it was a response to BME mental health, but it was one group who paid the price, was to count who's where in the system. Because people in the community, professionals in the community are saying, you know who's getting picked up on a 136, you know who's getting detained under the Act, and then another group saying, like, where's your evidence? It's all anecdotal, like, where's the data to prove this? Because there's this maybe urban rumour that black people are being warehoused in the system. So the accounting census is a commitment to count who's where in the system over a 5-year period to find out if it's just an overreaction, and you know these people always like overreacting about everything, or if it's based on hard fact. So next slide, please. So the Country census was born in 2005. Next slide, please. Data shows, oh, they weren't wrong. There is a disproportionality. Black people are 3 times more likely to be detained under the Mental Health Act in England and Wales than the rest of the population. Okay, so we can now see that the way the law is used, because the Mental Health Act is the only area of healthcare where you can be detained and treated against your will, is being used disproportionately against this group. Next slide, please. And so over a 5-year period, and remember this is our money, taxpayers' money, we're all paid with the NHS, Canadian census, 5, 6, 7, 8, 9, 10 are published. And this data, year on year, counts who's where in the system. Next slide, please. Actually, go back. Oh, it's too late. Because I wanted to ask you what you thought would have happened at the end of the 5-year period. Did everyone see the slide?
We'll test them.
Okay, what do you think happened after the 5? This is £100 million to address race inequality, have early intervention, community-based, culturally sensitive care, humane, compassionate. What do you think happened from there to there, as far as the communities that Black Mental Health Care set up to serve? What do you think happened?
It got worse.
You think it got worse? Anybody else?
It got worse, yeah, I think it got worse.
So is there a consensus that the thinking is maybe it got worse?
Yes.
I was very shocked to learn that after a 5-year period, counting census findings for 2011, and it was published in 2010, and they sat on it, and we had to really press before they published it, showed that while detention rates dropped nationally, so the use of the Act was reducing for people in the UK, they tripled for one group only. Next slide, please. So yeah, rates of sexual increased since Derry began, but falling for the rest of the population. Next slide, please. I think this is quite very important, actually. So the way people from the UK's African Caribbeans enter the system, the mental health system. Now this is health care, but the way people from the UK's African Caribbean communities enter the system, and maybe it's because of mistrust, maybe it's because of fear, but they enter mental health services in handcuffs. And I've spoken to the Home Secretary about this. I've spoken to anyone who, even if they don't want to listen, I'll speak to them about it. Because I don't understand why you're handcuffing people who need healthcare. I spoke to a chief constable and I said, if you know that they are a mental health service user, could you not use handcuffs? And anyway, we'll get there because it's not acceptable. But referrals via the police and via the criminal justice system is double that of the rest of the population. And so coercion typifies the Black experience of mental health care. Next slide, please. And so in January 2014, this is the last annual year, the CQC, which was the agency that was responsible for the last tranche of county and census report, they now publish an annual report on the use of the Mental Health Act. Now in this report you'll see how the Act is used. I should have bought some copies actually. And detail on all the rights you're supposed to have and then the reality. Their data shows that black people are 6 times more likely to depend on the Act. Now, the Cabinet census says 9, this says 6. All we do know, because quibbling over numbers is not that important, is there's a disproportionality. Next slide, please. I want to pause here. We're not madder than anybody else. Oh, sorry. Sorry, it's just something that's important to show you. I've got to take it out of my bag. So African Caribbeans have a higher prevalence of mental health than any other ethnic group. I've been doing this for 10 years. Black Mental UK has been in existence for 8 years. Believe me, if they had found something, we'd know about it. So what we're seeing is the use of a coercive measure rather than morbidity rates that determine the numbers of people from our communities that are in the system. Next slide, please. And then I'll explain why. So David Bennett was seminal. Next slide, please. And some interesting reports that relate to this issue. Now, the Equalities and Human Rights Commission are responsible for monitoring equalities, and they published a triennial review. Now, this report shows that a disproportionate number of people who come in contact with the police, who die in custody, are African Caribbeans. Now, Black Mental UK cannot ignore that when half of the people who are being referred to mental health services are going via the police. That for us is a concern. Next slide, please. The IPCC, who you might know about, well, yeah, okay, you know very well, obviously. They produce an annual report. Their policy work is, I think, quite important or quite useful, because they produced, the latest report was produced, I think, this month, and they look at the numbers of people who sadly have lost their lives in custody. Half. 50% of people who lose their lives in police custody and mental health service users. How are our communities entering the system? And this is important for us, because when we're making the case, the police have no place when it comes to mental health care for Black Britain, is very important. And this is what I told the Home Affairs Select Committee last week. I don't care if people say that mental health, and that's the message coming from the mental health is core policing. Black Mental UK's position is, given the treatment and violation of the human rights of this group, it cannot be. We need to find an alternative. Next slide, please. This is an important report. You saw the picture of Lord Toby Harris, who did the forward for one of our magazines. And the Independent Advisory Panel on Death in Custody there's a rotating chair, and it's the Ministerial Council. So this is high-level stuff. If the minister says something, it can make a difference. It can determine life chances. Now, their report shows of all detained settings, and so we have detention settings, we have prisons, we have police custody, we have mental health services. Of all detained settings are a question for you. It is a workshop. Where would the most preventable fatalities occur? Of all detained settings, I've mentioned them. So we have police custody, we have detention centres, we have prisons, we have youth detention centres, and we have mental health. And I'm sure we've got another thing, but I'm not sure. You know, like when people, anyway, I won't even go there. But of those detained settings, where do you think the most fatalities occur? Like, if you're going to do an aggregate, like... Police, yeah. Okay, so...
I'd say recovery home.
You would say recovery home. That's okay. Well, I would have thought the police... Oh my gosh. Well, one would have been excused for thinking it was the police. The majority of deaths that occur of people who are detained in the care of the state are those detained under the Mental Health Act. 60% or 60, yes, it used to be 61, now it's 60%.
We don't tend to hear those ones though. It's always about the police we hear. Publicity around.
Yeah. And it's a huge concern because there are hospitals in many urban areas that are 100% African Caribbean. They're places that are very difficult to enter, even relatives and carers have trouble, well, they have to negotiate quite a few things and are impossible to get out of. And what we would like to see more of is just people being able to do routine visits, because people who run community services say that people need to have somebody know that they're there for so many reasons. This panel is chaired by Lord Toby Harris, and they appoint people every few years. And so I applied and I was appointed to this panel in 2013. They make you sign all these documents and then the stuff that you know. Next slide, please. Mental health. The Royal College of Psychiatrists produced some research published in 2013, so it's less than 12 months old, on Asian mental health. And their findings show that Asian teenagers have better mental health and well-being than their white counterparts. And so when it comes to detention under the Mental Health Act, it doesn't apply to all ethnicities. The most coercive type of care is not uniformly applied. They have, according to the Royal College of Psychiatrists, better mental health. I think it's quite interesting that Dinesh Bugra, who was a former president of the Royal College of Psychiatry, said he would not allow a member of his family to use mental health services because he knows what goes on there. And then they said, why did you say that? This is their data. It doesn't mean that they don't have these kind of issues, it just means they're managing it completely differently. Next slide, please. Quite interesting information. The research showed that MPs have higher rates of mental illness than the rest of the population, so they're more likely to have a mental health condition. Now, in order to become an MP, you are invariably a member of the ruling class. Like if you look at the cabinet, it's just the elite. People who become MPs are very, very comfortable. So as far as, there's an argument about socio-economic factors determining mental illness. If that was the case, then why are MPs having higher rates of mental illness than the rest of the population? But anyway, it was acknowledged, and so in order to accommodate this fact, they voted to ensure that they had a personal budget of £25,000 per annum each, just in case they had a breakdown. So they could buy their mental health care in a constituency outside of their, where they live, because of stigma. So it's not morbidity, so people know how to look after themselves, is all I can say. Next slide, please. There's a lot of work in this area. Doctors and mental health, very interesting. Doctors, because DH, Department of Health data set shows 1 in 4 will be affected by this issue in their lifetime. You know that 1 in 4 stat that's thrown about. But according to the BMJ, I think it's the GMC, the General Medical Council done some research, it's 1 in 3 doctors.
That's a lot.
Yeah, 1 in 3, it's a lot. These are the people that have mental health problems. Their aversion of statutory services means they will not go near them with a barge pole. These services that they're running, they will not use. This research shows it. There's something called corridor consultancy. They're not feeling too well, so they go to their friend and say, what can you help me with? Because mental illness is considered to be a sign of weakness. These are the people running the service. They don't want to use it. Okay. Higher rates of mental illness than the host population. Next slide, please. This is not Matilda McCaffrey, this is not Black Mental UK. This is the BMJ and the GMC. Okay. The police. Higher rates of psychiatric disorders.
Oh, that makes sense.
Than the host population. There was a debate in Parliament at the beginning of this year that showed that I think it's 50% of custody sergeants have at least one condition like depression. Half. These are the people that meet and greet whoever comes into their services, their first point of contact. Higher risks of psychiatric disorders, and these are the gatekeepers to the service for our communities. So when I said that there aren't higher morbidity rates, the data proves it. Next slide, please. And so to where we are now. Because David Olawale should not have happened. And Sean Rigg sadly lost his life between 2005 and 2010 when DRE was running, when we had the money to pay for the early intervention, when there was a supposedly committed focus on making sure that people who look like him, because David Bennett, Sean Rigg, what's the difference? All the same blue. He should still be with us. He should still be with us. And so Black Mental UK's position will be, we will not stay silent on this issue, because there are those who claim that DRE worked, and those who claim that DRE worked were tasked with working with the Met, once Sean Rigg's inquest had concluded, to lead on work to service this group. We were very clear on our position. Because, was it Einstein who says there's a definition of insanity?
Yeah.
And if you do the same thing and expect a different result, that's not really good thinking. I'm not going to mention any names, but we'll continue. So, Sean Rick, and it goes on. Next slide, please. He would have been a doctor by now. He had done his master's, his mother's a lawyer, he had stopped sleeping, he went to A&E, they said, oh, you need to go to the other hospital. So they said that he should go to another hospital, so I'm not going to say the name of the hospital, but this case is just incredible because you'll remember that David Bennett was a revolving door patient and entered the system at 19 and died at 39. Oliseni Lewis was 21, less than 24 hours later. They called the police. 15 officers, 15. Are there 15 parts of your body? 15. Less than 24 hours, Oliseni isn't with us anymore. Next slide, please. He would have completed his PhD. Kingsley Burrow-Brown, you probably all know about. Lives in Birmingham, called the police for help because he was in an area, didn't feel well, didn't feel safe, was with his young child. They picked him up, took him to a mental health hospital. When his son, who was with him, went to his parents, his son told his grandparents he saw the police beat his daddy. In a few days, the police went back. Kingsley Burrow-Brown is no longer with us. In 2014, this summer, the CPS, and if you was on the front page of The Voice. Next slide, it might be here. That's what they did to him. Physically healthy man who was going to be a fitness trainer. The CPS, and it took the IPCC, I think, over 18 months to do the investigation, and they held on to Kingsley Burrow-Brown's body for 18 good months. The CPS said, oh, there's no case to answer. Sorry, no criminal charges. That was last month, and so, of course, his sister led a march because she's not taking this. Next slide, please. Jacob Michael called for help, and that inquest. And when I talk about generational impact, it's more than this, because these are the mental health cases, but you've got to remember Smiley culture, you've got to remember Mark Duggan, there are many in between these cases. It's not just people detained under the Act. And the look of disbelief, I'm glad you're fake, because I cannot believe this. But anyway, Jacob Michael called for help. They sprayed him, took him into a cell. It says CCTV, now every death is filmed, and yet they still can't find any reason for negligence. And he's asking them for mercy. Anyway, they didn't give him any. The disturbing thing about these cases is, many of these people you see here, the shock is so much that within 12 months their parent dies. Within 12 months, Mark Duggan's father is no longer with us. His mother suffering from very severe cancer. Within 12 months, Michael's father is no longer with us. His mother critically ill. This is not...
Yeah, I'm just saying, the last three cases you brought up on the screen, they've actually asked the system for help. It's making us frightened to call for help at all now.
Well, one of the arguments is the reason people are getting a diagnosis of psychosis because you won't go to the services early, but yeah. This is a human rights issue. This is a social justice issue for Black Mental Health UK. Other organisations might have a different opinion, but the phone calls we're getting, the experience of the priorities that we have decided to focus on means this is the lens we see things through. Next slide, please. And Amalia, at the beginning of 2013, on the 1st of January, I think it was, he wasn't feeling very well, he'd been into the services before. His father is English, his mother's African Caribbean. And so he asked for help. And for 3 weeks they wouldn't allow any family member to speak to him. They removed him 3 times. When the family were allowed to view his body, there was bruising and all sorts on his body. The coroner said, oh, maybe it's natural causes. You don't die of natural causes at 23. Next slide, please. Leon Briggs. The thing is, the reason I'm sharing this with you is because it's shocking that information is power, and we need to know these things because it's not in isolation. And Amalia Birmingham, Oliseni Lewis, Croydon, Sean Rigg Brixton, Leon Briggs, Luton, November. You'd have thought one would make them relax and not do anything for a while, because people come out into the streets for March. But he needed help. He wasn't feeling well. The TSG came. That's it. That's it. But remember, I talked about body-worn cameras.
Mm-hmm.
The reason they're being introduced is because of Leon Briggs. Believe me. Next slide, please. So the HMOC is an agency that is responsible for Her Majesty's Inspectorate of the Constabulary. So they produce reports. They produce some damning reports that have embarrassed the Met into maybe changing a bit of practice. But their report showed that the use of police cells is criminal. It shouldn't happen. Like, this is something we've been talking about for a very long time. The thing is, the use of police cells shouldn't happen, but really police contact shouldn't happen, because we've seen what happens. But next slide, please. Another, I think, really important report, and this is a focus. This is a priority for Black Mental Health UK, is taser. Now, they were introduced as non-lethal weapons. We gave evidence to City Hall's London Assembly's Police and Crime Committee when they were thinking about introducing them. They say they're non-lethal, but I don't know. If they're going to electrocute you and you've got a weak heart, how non-lethal are they? But anyway, in the last 12 months, last year, so their data shows, and this is the Police and Crime Committee, this is City Hall, this is not the community. I'll ask you the question. So what percentage of people who are tased in the last 12 months come from our community, do you think?
80.
70%.
70%? 80%? Any other offers?
99.
99%, okay. 50% of people who were tasered in the annual report of, in the 12 months this report was looked at, are African Caribbeans. Now, taser's a new weapon, and the use of against people who've got mental health problems has gone up by 30%. I don't know if you've heard of the case of a pensioner who, and this is an English pensioner, it was outside of London, and he goes for a drink, I think early in the evening, and he'll stay in the pub for the evening, and he's got a white stick because he's partially sighted. And so he was walking along, and then he thought he was being attacked by thugs, and an officer just tasered him. And then, this is an old English man, vulnerable man with a white stick. And so he thought he was being attacked by thugs. And then the officer said he thought it was a weapon. He thought the old man was carrying a weapon. The old man now doesn't leave his house. So I don't even know why they were introduced. I don't know why they were introduced. There's a concern because if you have a weak heart, and even if you don't have a weak heart, this is a huge concern. And we're concerned because of the disproportionate use against African Caribbeans, like other...
Also children, huh?
We will have to ask. Thank you very much for that.
They are.